University Catholic Santiago of Guayaquil. Name: Veruska Vera, teacher: John Moscoso. Terms and Emphysematous cystitis. Introductions. It is rare anti-characteristic picture presence of gas in the wall or bladder, lumen, and complications of an infectious process in the lower urinary tract. It is diseases that are female predominant ratio to 1, and thence to be observed in the geriatric populations. 6 or 7 decades of life. Half of the patients have diabetes mellitus or oncolysis glycemia as a predisposing factor, and the microorganisms most frequently found are Escherichia coli and Klebsiella pneumoniae. Play. Applications in nursing. Clinical, the patient presents productive accompanied with characteristics, pain in cities, streets, and fever. It occurs with a sudden start. The diagnostic is carried out through the clinical triad bacteriologic. Epidemiologically, we know that it's bacteria of universal distributions with a higher prevalence of pneumonia in winter. There are vaccines available against the etiological agents being recommended that conjugate of 7 valence, being the one that has greater immunogenic capacity, provoking antigen-dependent responses. Regarding the laboratory diagnostic with most performance boosters, sample collections, bronchoalveolar lavage, use of or pleural fluid, which gram plus capag diplosis are essential. Our culture should also be correct of the typical list such agar and broth. Play.
With cystitis, cyst refers to the bladder, and itis refers to inflammation. Therefore, cystitis describes an inflamed bladder, which is usually the result of a bacterial infection, but also can result from fungal infections, chemical irritants, foreign bodies like kidney stones, as well as trauma. Watch the full video on osmosis.org.
Pros and cons. It has no pros book is the contrast and its characteristics be the presence of gas both in cities, the bladder and in the wall blood. Causes be the presence of gram-negative aerobic bacilli smelling gas formers. The risk factors that predispose to these pathologies are diabetes mellitus females, jaundice, recurrent urinary tract infections, obstructions of the urinary tract, neurogenic bladder, and immunosuppression status. To play. Definitions: Emphysematous cystitis is
Definition: Emphysematous is a non-common infection which affects the bladder walls by a gas-forming bacteria or fungi, the most common being E. coli. Other type of bacteria, Klebsiella, Proteus, and other type of fungi as Candida. Proven to cure emphysematous over the time and reduce the amount of gas inside a bladder wall. Prognosis is poor if antibiotics are not used to treat the patient. Additional treatment consists of urinary drainage and good control of blood glucose. The treatment of underlying comorbid diseases such as diabetes is extremely important because they can intensify the infection. Why it may be found in the surrounding areas of the anus due to the elimination of fecal length of the urethra, colonization is allowed. E. coli gets anchored in the walls of the urinary tract, preventing its removal with the urine. 2009, urinary tract infections represent the 10.3% of diseases in women. This disease most commonly affects elderly, diabetic, and immunocompromised patients.
Sui applied in Ecuador. Emphysematosis in Ecuador is very rare. Characteristics be the presence of gas in the wall of the bladder and occasionally within it. It's associated in general to female patients, diabetics, immunosuppressed with recurrent urinary infections, and urinary ectasia 1, 2. Today, there are scarce publications or international literature unknown at the national level regarding the disease. In Hospital Teodoro Maldonado, there are about 49 cases so far this year. Play.
Emphysematous cystitis. Definition. Emphysematous cystitis is a rare entity characterized by pockets of gas in and around the bladder wall produced by bacterial or fungal fermentation. The presentation may be atypical and contrary to the degree of inflammation. Patients may present with exotic clinical findings. Patients may complain of irritative symptoms, abdominal discomfort, pneumaturia. Symptoms. This disease is often characterized by non-specific clinical symptoms with little or no diagnostic clues. It is defined by the presence of air within the bladder wall and or the bladder lumen in imaging studies. Quiet, please. In my case, my symptoms came on very suddenly, very strongly. Actress Melody Thomas Scott didn't know the cause of her sudden symptoms, but she had an idea. I was in a car, perfectly fine, 1 minute, and the next minute, I was doubled over in pain. Thought I had the worst bladder infection of my life. It just happened. Boom. Very, very suddenly. But it wasn't a bladder infection that had the star of the popular daytime soap opera, The Young and the Restless, doubled over in pain. It was a mysterious condition called interstitial cystitis. A condition of the bladder, interstitial cystitis, or IC, can affect anyone at any age without warning. And due to its association with the bladder, many confuse the disease with a bladder infection and oftentimes go untreated.
A lot of people think that IC is.
Cystitis is a condition which results in constant urge to urinate and a burning sensation during urination. There is also pain in the lower abdomen and back. The urine passed by the patient is thick, dark in color and has a pungent. Extract its juice. Consume this juice once daily and you will see an improvement in your condition. Take 1 cup of cucumber paste, place it on a sieve, extract its juice, add 1 teaspoon of honey, add 2 spoons of lemon juice,
पेशाब 2 बजे से नहीं लगी है।
पेशाब नहीं लगी शुरू से?
लगी मतलब आती है लेकिन उतरती नहीं।
उतरती नहीं है?
इसलिए दर्द हो रही है।
अब जाओगी पेशाब करके फिर वापस आओ।
पेशाब
बिल्कुल नहीं होगी? ठीक है जाओ, कुछ रुपये जाओ।
To stop it. Conclusions. 1. Emphysematous cystitis is defined as a presence of gas at the level of the bladder wall of infectious cause which may or may not have associated intraluminal gas. 2. The pathogenesis of emphysematous is unknown, probably due to multifactorial mechanisms. The most frequent isolated harm is Escherichia coli. 3. The clinical on emphysematosis is non-specific, so if diagnostics is made through imaging tests, mainly CT. 4. Treatment consists of adequate glycemic controls, intravenous antibiotics, and bladder drainage. 5. The prognosis is generally good, except in 10 to of the cases in which surgical treatment is required due to the experience of complications. Thank you.